The wise words of Marshall Mathers: his hands are sweaty, knees weak, arms are heavy, vomited on his sweater already, mom's spaghetti, he's nervous. These profound lyrics are actually related to generalized anxiety disorder. There's a lot of talk that anxiety is just some fictitious tale that crazy people tell themselves when they're stressed out. Society is ill-informed on the topic, and even though people that go through these tormenting feelings actually are in a stage of avoidance. According to Everyday Health, because of this vicious cycle of anxiety, fear, and worry, it leads to avoidance of the subject, which further strengthens the fear and worry. Breaking typically free takes professional help. How do we relay that this illness is real? Mental illnesses such as GAD can be detected through proper counseling, stats that can't lie, medicine and natural remedies are proven to be beneficial, as well as that our peers, loved ones, and non-believers can communicate with empathy. I was diagnosed with GAD early on in life, and I never knew how to explain the symptoms. However, a good way to sum it up would be by the Anxiety and Depression Association of America, when they report people with GAD don't know how to stop the worry cycle and feel it is beyond their control, even though they know that their anxiety is more intense than the situation warrants. Daily life can be a slippery slope, especially when others cannot sympathize. Even though there are proven statistics that this illness is not a fallacy. According to the ADAA, anxiety disorders are the most common mental illnesses in the U.S., affecting over 40 million adults 18 or older, which is 18.1% of our population every year. This cannot be just some random number. With the evaluation from a psychiatrist that went through extensive schooling for recognizing the telltale signs of how long and to how often these GAD patients have had it. Anxiety is something that everyone deals with to a certain degree. But when it is impossible to live life, it's a clear indicator that it is generalized anxiety disorder. I visited the emergency room more times than I'd like to admit. And every time I've been discharged with tests done and nothing found. Physical symptoms can be nausea, diarrhea, muscle tightness, and body aches. Anxiety has to be real if these administered ER drugs can make you feel 110% when you were feeling 5% in the last 30 minutes. The excessive worry with GAD is strong enough to trick your mind into some absurd things. Once people realize that anxiety is playing tricks on them, they have more opportunities to cope. Medicine can be a hit or miss. Some people thrive, some people don't. Highly effective anti-anxiety medications are called benzodiazepines, which help relax your muscles and calm your mind. Another way to cope would be natural remedies and exercise, getting the body active and sweating out the toxins. Essential oils and yoga are good for wellness too. I started to skate and draw, which drastically changed my outlook on life. Sometimes the mind just needs to focus on other activities. People with GAD may go through many ups and downs, and it's imperative to have a good support system. Sometimes loved ones, peers, and non-believers just don't get how to help. But with proper communication and empathy, it's very possible to flourish. I feel sometimes like I'm alone. According to Star Very Well Minds, many people with panic disorder distance themselves, fearing others won't understand. People in your life can be empathetic though, and they understand that help is possible. The more I realize that everyone has issues, the easier it was to deal with this. All I can do is communicate when I'm feeling uneasy. People with GAD use breathing exercises, self-talk, and executing their feelings in a mature way to get the point across. Kindness and patience will always benefit, and when anxiety is around, understanding is key. Even though not many people really know what this feels like, everyone needs just to be heard. GAD is not a fun thing to deal with, being the person that has it or being the person that goes through the hoops to understand it. And there's more, they have stats that don't lie, natural remedies and medicine that can help, and easy transitions